Welcome everyone to today's SWA Insights, where our goal is to provide you with valuable insights in the investment and comprehensive financial planning world. I'm Amy Stuber, Senior Wealth Advisor, and I'm excited to be joined again by Donna Fox for Part 2 of Medicare 101. Donna is an insurance specialist in Medicare and individual health insurance. If you didn't catch our first episode, be sure to watch where Donna covers the top Medicare questions. Today, let's get into more detail about Medicare coverage. Donna, you and I have talked before that you spend a lot of time with each client learning and understanding their unique needs so that you can guide them towards the best insurance solutions. So there are a lot of options when it comes to Medicare, or at least how it can work for you. It's not just a one-size-fits-all. There are a lot of parts and letters still. So walk us through what each means and how they all work together.
As we mentioned in the last session, the first step is to enroll in Medicare Parts A and B. Medicare Part A helps pay for your hospital stays and inpatient care, including acute hospital care, inpatient mental health care, skilled nursing facility care, home health, hospice, blood for transfusions during inpatient care. You also have Part B. This helps pay for your doctor visits and outpatient care, including outpatient hospital services, physician services, ambulance, lab services, home health care, durable medical equipment, therapy, and some preventive care services.
Okay, that's a great overview of Part A and B. Is that all that's needed? It covers a lot, or is there more for adequate coverage?
Original Medicare provides good coverage, however, it doesn't pay for everything. For example, Medicare generally covers about 80% of Part B cost. It's up to you to cover the rest of the cost. Medicare does not have a max out-of-pocket limit. So after you enroll in Original Medicare, there are two ways to get additional coverage. Option one is a Medicare supplement plan that is offered by private insurance carriers, and it helps pay some or all of the costs not covered by Original Medicare. Medicare supplements, as we learned last time, is interchangeable with Medigap plans, so those are the same things. The Medigap or Medicare supplement plans are standardized, so regardless of the carrier that you select, the plans are the same. Plan G is Plan G is Plan G.
Okay.
However, while the core benefits are standardized, the premiums charged by different carriers can vary based again on age and your demographics. In addition to a Medicare supplement, you would add a Medicare Part D plan. Part D plans help pay for your prescription drugs. All Part D plans have a formulary, which is a list of covered drugs in their plans. Additionally, the drugs are broken up into tiers. Typically, Tier 1 and 2 drugs are generics. Tier 3 and above drugs are specialty drugs. Tier 3 and above drugs generally have a deductible and then co-insurance.
Okay.
Another option is to choose a Medicare Advantage plan. Those are offered by Medicare-approved private insurance carriers. Medicare Advantage plans are called Part C. That combines your Part A, hospital, and your Part B, medical, into one plan. Part D, the drugs, could be included in the Advantage plan as well. The other thing with an Advantage plan is they could offer additional benefits not covered by traditional Medicare, such as dental, vision, hearing, and that type of thing. When you have a Medicare Advantage plan, you're essentially assigning your Medicare benefits to the private insurance company. This means the insurance company, not Medicare, manages and pays for most of your healthcare services covered under Part A and Part B. You still have Medicare, but your coverage is administered through the Medicare Advantage plan.
Okay. So we have A, B, D. C that could combine all three.
Mhm.
So one more time, can you give us a quick comparison of original Medicare with a supplement and the Medicare Advantage plan?
So with original Medicare and a supplement, you have choice, which means you can go to any doctor and hospital that you choose. You have control. You can go to a specialist without a referral. You have freedom. You're covered anywhere in the United States that accepts Medicare. You do have a monthly premium. The coverage for Part A deductible is covered under a supplement and the co-insurance. Coverage for Part B co-insurance is covered after the $257 deductible. With the Medicare Advantage plan, you still have original Medicare benefits, but they're covered through the private insurance carrier. It often includes your prescription drug coverage. Additionally, Medicare Advantage plans may cover benefits not covered by original Medicare, such as dental, vision, hearing. Medicare Advantage plans typically have low to no monthly premium, but you do have copays for services as you have them. And generally speaking, you do need to use in-network providers, and some services do require pre-authorization.
Donna, thank you so much for sharing all of that information with us. It's really been helpful. I know I learned something. There's plenty more that we can talk about regarding Medicare, but we're going to have to stop there for today. And thank you all so much for joining us. If you have any questions at all, or if we can help in any way, please reach out to me or another member of our SWA team, and we'll see you next time.